Overlooked by the peaks, Tameside and Glossop PCT delivers services to patients across 3 counties. Here they've decided to encourage GPs to put into practice their own ideas for treating patients. In Gamesley, GP Alan Dow has been working with the PCT in implementing a new programme to avoid falls in the elderly. It involves the use of mineral supplements to strengthen their bones.
There's a lot of evidence that giving certain calcium and vitamin D supplements will actually prevent fractures in an elderly, mobile population. So by doing that, by prescribing for the right group of people, we know there should be an outcome where they actually fall less, fracture less, and are kept healthy and well.
In Hyde, Greater Manchester, Dr. Raj Patel is preparing for a dermatology biopsy. He's going to take a skin sample for a patient in a minor operation which would normally be done in the local hospital. But thanks to backing from the PCT, he's now able to perform the task at his clinic.
Instead of having to go up to the hospital, which many of them find quite a difficult experience, and they often find it very traumatic and anxiety-provoking, they much prefer to come here, to have this treatment from someone that they know, and also it's on their doorstep.
Dr. Patel and his colleagues also offer blood tests, ultrasound scans and gynecology services. The biopsy is never a pleasant procedure, but performing it here has put his patients at ease.
Because Dr. Patel knows everything about me, it's not as if you're seeing somebody different and can't really remember you anyway. Even just looks at his notes, but no, it's good.
At the PCT headquarters, Chief Executive Tim Riley believes practice-based commissioning offers the best solution for patients and doctors.
We're not talking about introducing practice-based commissioning purely as a policy. What we're talking about are practical means that they have to be in the driving seat when they're determining the services they want, and using their collective voice to make those services come into being and deliver in the way they expect.
A few miles away in Stalybridge is the clinic of Dr. Neil McNeil. 2 years ago, he asked the PCT to fund a surgical retraining programme so he could perform vasectomies. So he now has a fully kitted operating theatre and has performed more than 150 operations. He treats not only his own patients, but those of neighbouring GPs.
Other GPs who refer their male patients for vasectomy to me, so therefore I am the service provider for this service, and I'm the route, if you like, for their practice-based commissioning.
Back in Hyde, the biopsy is almost over, and Olwyn will have avoided a hospital stay. It's clear in Tameside and Glossop, practice-based commissioning is making a real difference to patients' lives.